Hello and welcome to Beauty Fruit. I'm Jeff, the Beauty Fruit's husband, as some of you already know. Today you're going to go with me on a journey as I visit Dr. Durairaj in Pasadena. I'm not the type that gets a lot of beauty treatments. I'm not on the other end where I'm using shampoo and conditioner in one, but I'm definitely, not high maintenance in the beauty department. I work as a lawyer, and while I want to feel confident and look good in front of a jury, I'm not obsessing over every line and every imperfection. I did notice last fall the marionette lines here, and so I went and for the first time I got a little bit of filler to see whether it would make any difference. I didn't want to spend a lot of money and have all this pain and yet not be able to tell that anything was done. So I tried it out, and I got a half of a syringe on each side, and I was really happy with the results. I had also been concerned about some bags under my eyes, and the doctor mentioned that, actually counterintuitively to me because I don't know anything about this stuff, that if I replaced some of the volume loss in my cheeks, it would actually take away some of the bags underneath my eyes. So that's what I'm going to do today, get some filler and maybe some aesthetic Botox. You'll come with me and we'll see what happens, and if you wait till the end of the video, I'll give you my final thoughts and what I thought about the whole process, and you'll see before and after.
So we would do, I think it would be very nice today, since you're feeling tired in your eyes, a little heavier around your mouth. I think cheeks is the perfect solution to that, and I think more men need to think about doing something with, when you talk about getting cheek injections, sounds horrifying to most guys, because they're like, no, I need to stay like, masculine looking. What I actually mean is to give you that little chisel back, because your apple of your cheek does not belong down here. It needs to come up in this direction. So I'm just going to follow your natural bone structure, put some volume back, and that supports the eye so we don't have heavy weight tractioning down on the eye. We can come in then and do a little Restylane in the under eyes and treat that. In the future, I think you'd be a good candidate to do a little jawline tightening. I use the same filler that we're going to use for your cheeks, Radius, to tighten in this direction, and a little bit of filler to soften the marionette lines. So I think starting with one syringe on each cheek is perfect. And oftentimes for the jawline, we need two, because a man's jaw is quite long, and that just boils down to needing more volume to cross that area. So what you can see, roughly the size of the cheek is roughly the size of the syringe, and we're placing that from here to here. And you're going to feel a little quick pinch. Right now we've already pre-numbed, and here we go. Perfect for Father's Day. 1, 2, 3, a little pinch. Okay, good. And then you're going to hear a funny crackle. Often that's fine. Crackling is normal. How's that? Does that feel sensitive there?
No, it's okay.
Okay, good. And had you lost any weight recently?
No, in fact, I think with the quarantine, I put on a few pounds.
You did. You guys have been having good recipes produced.
He's been cooking.
Relax and smile. Good. Perfect. Okay, we can do a little nice volume in that mid-cheek area, and then I'm going to help this cheek to pull up and back.
Okay, so tell us what you're doing.
Okay, so look straight ahead for me. Today I'm going to do cheeks contouring and actually creating a chisel back in the cheek, and we can see this handsome gentleman. How it looks so good.
Thank you.
I'm starting to feel a little heavy in this area, and that's causing traction and pulling down on the eye. So one of our goals in replacing cheek volume is to lift heaviness along the mouth fold, and the other goal is to improve that traction on the eye. So right now I'm putting some cheek contouring filler. Looks good.
Yeah, don't go to someone cheap. Go to someone who knows what they're doing.
Yeah, I would agree. I think a lot of times people think like a syringe is a syringe and you can get one at this place and that place. And like, you can get really cheap stuff in downtown, but that does not make it good. You need the injector to be the person who guides, all of the placement of the product. It's really not about what kind of filler I'm using. I can get this result with almost any filler. It's about the placement and the anatomy knowledge. So right now you can already see like that lower face heaviness has lifted a lot, and that's just by, this is a very natural amount of volume. It'll feel slightly swelly for 2 or 3 days.
Sure.
And swelling goes down and then you kind of miss it. But it's kind of recreating some natural youthful contours there. And sometimes we can style the cheek. Some patients like a more masculine effect, some patients like a more feminine effect. We can do either. And right now I'm just going for kind of neutral and matching kind of your style, a little more rugged, and just building on your own bone structure, actually. And that always looks right because that's your own bone structure. But of course I do have the artistic eye to be able to tweak that and give people any kind of result that they, can envision for their own face.
Yeah, I was really happy with when you did the marionette lines. We only did a half a syringe on each side, but I wanted to see if I would like it, and I did, and I was real happy with it, and I will come back to...
Yeah, I hope that men start doing, I think like doing a little touch of maintenance every year is so important because the facial bone structure changes, the underground fat pads and muscles change. And then when we just replace that in small, precise quantities, it just really looks nice. And you can see already how this side of the face looks great. What do you think?
Oh yeah, it's pulling up this way, and this is more...
Probably your under eyes too.
Yeah. Your eyes actually look more refreshed, even though we haven't even touched your eyes, and then the lower face actually looks definitely lifted as well, the heavy fold and pulling down.
Yeah.
It sort of changes the focus to the eyes versus feeling down here. I like it. Great. You're doing one more syringe, right? So you have these two, and then you're going to do a third one?
I told him
Or
he should
just
probably
do
do the third for the under eye instead of the marionette and just use the Xeomin for the lateral
For the
corner.
muscles. Yeah, that's one good
What do
option.
you think, Joe? I mean, it's your face. So you
Yeah,
decide.
I go with whatever.
I would say do the under eyes.
Yeah.
You can do Restylane Silk for the under eyes with the insulin syringes. Okay, good. Okay, now we're going to do the same thing, and we're making kind of a more squared cheek, and as we age, we are naturally going to lose some bone density in the facial bones. And one of the most important things is taking your calcium, and hopefully you're doing that. If not, I want you to start.
No, I'm not taking calcium, but I will. I'm taking
Yeah.
vitamin D.
Vitamin D is great, and then sometimes, we don't really take a lot of calcium in our diets unless you're a big dairy drinker or you have yogurt every day.
I do like yogurt, and I do use half and half in my coffee, but that's probably not enough.
Yeah, I remember when we were little, we had to have 3 glasses of milk every day, like one with each meal, like, oh my gosh.
Yeah.
Yeah.
What would you say, Dr. K, are some other good procedures for men with fillers or Botox? Where would you tell a guy to start? Is it more so, obviously, you're going to do a consultation, but what do you think is, if someone was, say, on a budget, what would you say is kind of like one or two things that are good, easy correction?
Well, I think every guy is a candidate to do a little bit of Botox. In our practice, the most common procedures for men would be Botox for the brows, and especially crow's feet. Men really have paid a lot of attention to their upper faces traditionally, so Botox for forehead lines, for crow's feet, and then I see a lot of men who get under eye treatment of dark circles and hollows done. And the under eye is so popular because you instantly can see brighter and more refreshed appearance without surgery. And some guys do surgery, but a lot of people will start with filler there. Let me grab half a syringe more and take a look already at how nice that looks.
Oh yeah.
That's much better.
Oh yeah, it's much better.
Looks really good. Okay, right over here. And I think that just kind of echoes this little nice curve. Looks youthful. In photos, that'll look so photogenic. And now I'm going to come in and do the under eye filler, and I'm going to use just half a syringe of filler to keep it really hydrated. Look straight ahead. I do think under eye surgery is popular for guys too, and just because they don't have the ability to put on as much concealer, and most guys don't wear as much makeup as women do, but because of that, under eye surgery is one of those things that people do to stay refreshed, so they look good at work, so they don't feel like they're aging out of their jobs, and just gives you more confidence. You know, when you wake up looking tired and feeling like you're not yourself, or you just look tired no matter how much you sleep, it can erode your confidence. So this
Yeah, and I
gives
have to be
you,
in front of juries. Of course, I don't know when we're ever going to have a jury back, but
Right.
with COVID, but
being in front of a jury, like you're
that's a big part of my job.
forward facing, looking refreshed and bright and confident matters a lot.
So would that be like a lower blepharoplasty where you would do more like a fat sort of thing, like kind of deeper in like the orbital sort
in
of
here it
area,
would
or the
be-
upper blepharoplasty too, would you say?
I would say both. In his case, maybe upper lids to trim and tighten excess skin right in here. And then if you look straight ahead for me, the lower eyelids have a little bit of a fat pad protrusion. We can see that when we push, orbital fat kind of protrudes like that. And then on this side as well, a little bit more. So that's taken out from the inside of the eye with the lower eyelid blepharoplasty.
It's the same as you did on that side, right?
Pretty much. We're just going to go in 2 or 3 spots here, and you're going to look up slightly with your eyes for me. There's a lot of veins, so there's a small risk of bruising, hopefully not much. We're going to be careful to not inject anywhere near this, or this orbital fat is something that we would take out surgically. So today with under eye filler, we are going to camouflage what's called the tear trough. That's this deep groove. And adding filler here blends and camouflages the junction between the lid and the cheek. So it's a temporizing measure. The gold standard is surgery, usually. And sorry, hon, 1, 2, 3, little pinch. And I'm using a soft gel filler, a Restylane product, and this is going to just kind of instantly refresh the depth of that hollow. Typically we might need for a man 1.5 syringes per side, so a total of about 3 syringes. When I do filler, I'll start in the middle first. I want to hydrate this portion of where people see you. Later we can pay attention to the outer half of that circle, but this is where people really make your eye contact, and we need to make sure that looks refreshed. And I'm palpating and feeling for his important nerves, infraorbital nerves. We're making sure we're nowhere near vascular structures, which can be challenging because he has a lot of veins. People who have a ton of veins like this typically have nasal allergies. Do you have any tendency to allergies?
Yes, I do.
Yeah, there you go. So taking your daily antihistamine is an important adjunct to making sure your filler doesn't get too...
I take Flonase, yeah.
Yeah, that, as well as we want you to probably do an allergy tablet like Claritin or Zyrtec. So 1/2 syringe per side is going to be a very nice start, but it's just a start. We're going to come back and do more, probably in about 6 weeks, and then gradually that'll look more refreshed and hydrated, and just kind of, it does, filler acts like a sponge. It absorbs 1,000 times its weight in water, and it's going to really settle in over the course of 2-3 weeks. So we don't want you to judge it right away. You got to give it some time.
And Dr. K, why would you prefer to use a needle versus a cannula? Do you ever switch to
Well,
using a cannula versus
I
a
do
needle?
often use a cannula. In fact, I'm a big cannula user. But in this case, when someone has such prominent eye pads, look up, when the fat pads protrude, I need to place the filler so carefully, and I want to be very atraumatic. A cannula actually is blunt and kind of pushes and tears its way a little bit through tissues. So I have found in my experience that blunt dissection with the cannula can make these fat pads swell more. Just they pick up some neighborhood swell. So if I just can get in and out with one very tiny needle, very safe technique, with minimal disruption of all the remaining tissues, those fat pads appreciate it and they don't swell. Last little bit right here, and 1, 2, 3, little pinch. Hopefully you don't have too much sensitivity there. It feels like just a quick bee sting, right?
No, it's all been pretty painless.
Oh good, I'm glad. Yeah. And we numb nicely with a good under eye numbing and nerve block sometimes when I use the cannula. You can see right away that little softening, nice layer of hydration, just camouflages that better. Okay, now the Botox. So you have 20 units of Botox, is that what we're doing?
Yes,
pointing at 4. Do you want to do any around your brow?
No, I just had
Just
a
the
whole bunch.
Depressors.
Where else do you think you would benefit from it? I don't know how many units you use in the
Let's see,
DAO.
close your eyes tight, and open, and raise your brows up higher. So when they do your Botox the next time, it's too much frozen. Like, you need some lift.
Yeah.
We need to draw for them, like, this is the no-fly zone. Don't put any in here.
I think they're also, it's for the migraines. So they
No, you
were,
don't need it. Your
no.
migraines will still be better without getting heavy.
Okay.
So
Do you think a
just-
little lateral brow, would that lift and kind of take away from
Yeah,
the
we
hooding
can.
appearance maybe?
Sure. Make a pouty expression. So now we're going to treat these depressor anguli oris muscles, the DAOs. I'm giving a couple drops of Botox all up and down the route of that muscle. We want this to stay neutral. And I also think a couple drops in your chin will improve chin projection, because when the chin is always tenting in, it looks blunted. So let's see. But if I have just a little left, we probably would do it here. Close your eyes tight, and open. Okay, we can do a little drop for brow lift effect. And here too, close tight and open. You don't have too much motion here, so that'll be subtle, but it might help a little. And then the rest can be in your chin.
What about for Jeff for like a piriform injection? Do you think he has a little bit of, like just as I
Yeah,
noticed, do you
he
think that
does.
would lift a little bit?
I think it would be nice because of these deep lines.
That's what I
and
was thinking.
He has a little loss of the deep medial cheek fat, so when we
Mhm.
did this injection, this is all lateral cheek, so coming back to do medial cheek in here is going to be very nice as well. And that's just slowly adding the volumes where he needs them. So, all right, handsome.
Thank
did
you,
good.
doctor.
Thank you. Did a great job. I think that looks a lot more refreshed. Still looks like you.
Yeah.
Looks great.
Oh, that-
Take a look
Look
in the mirror.
Oh, yeah. That looks
Very
a lot
nice.
better.
Yeah.
You look younger.
And now maybe we can do his after picture.
Okay, so we're back from the experience. Now, it's to be expected whenever you have a needle put into your face, you're going to have swelling and usually some bruising. This is no different. So let's have that caveat. It's going to take a few days for the swelling to go down and for everything to kind of settle in. Since I was on a budget, I had a set amount that I wanted to spend on the process. I had 1 syringe, I believe, of Radiesse in each cheek, and then a half a syringe of Restylane Silk under each eye. They did not use a cannula. She used a needle because she mentioned the cannula is blunt and might cause more damage, especially since I have a lot of veins and capillaries in that area. And so she did that. And then instead of using the 1 syringe of the silk in my marionette line, since I'd already had it partially done before, she mentioned to put some Botox in the corners of my mouth, which would help uplift it. I have noticed already that there's less bags under my eyes, even with the swelling, and that the cheek area is a little bit more defined, and I expect over the next couple of days that will get better and improve. And so I was really happy with the whole process. It wasn't that painful to me anyway. The under eye wasn't really painful at all, but I was happy with the process. Now, some of you may be saying to yourselves, well, I'm a guy, I feel weird about doing this, and I'm gonna be deemed high maintenance or something along those lines. Here's the deal. If you're 40, 50, 60 years old, you're going to have volume loss in your face, and you're going to age, and people are working and living longer today. We're not passing away at the age of 45 like they used to. So you're going to want to look your best. I have to be in front of a jury. I have to be in front of judges. I don't want to have a plastic look about me. I just want a really natural, refreshed look. There's nothing wrong with spending a little money on upkeep to make you look your best. This is, and you should view it as kind of maintenance for your life. Wouldn't go 10 years without seeing a dentist and then come in and have a cleaning done and expect everything to be okay. You need to keep up with it. So this is kind of along the same lines. You're doing it once a year, once every 2 years, depending on what procedure you get and how long it lasts. You can expect that Each syringe of the filler is going to cost somewhere in the neighborhood of $500 to $800 a syringe. And if you do some once every year, once every 2 years, it's pricey, but it can be more manageable if you spread it out that way. The difference in price, of course, I mentioned this earlier, you're paying for the doctor's skill level, because you don't want to have a complication, someone putting a needle into your face. A lot of things can happen, so you want to be sure that you have someone that knows what they're doing. Overall, would I recommend it? Yes, I would. There's very little downtime. It was relatively fast. I felt confident in the doctor's ability. So I would recommend Dr. K. I'll leave her information down below. I did not get free services in exchange for saying this. So my view is, yes, I'm glad I did it. I would do it again in the future. I'm already noticing a positive benefit. So thanks so much for watching. Enjoy Beauty Fruit.
Hey guys, it's Steve, aka The Beauty Fruit. I wanted to put Dr. K's information here at the end of the video in case any of you guys want to check out her work or book an appointment with her in Pasadena, California. Her Instagram is @beautybydrk and her website is beautybydrk.com. I'm going to leave her contact information with her phone number and everything in case you guys want to call up and inquire about pricing or any specials she's running, or if you'd like to make an appointment with her. Thank you so much for watching, guys. Also, make sure to check out my first lip injection experience. That video will also be down below on my channel. I love you guys, and I will see you in my next video.